receptacle outlets installed in the concrete slab floor of a patient care area in a dental clinic are required to be ground fault protected. This requirement is found within the National Electrical Code, specifically in the Healthcare Facilities section. Ground fault circuit interrupter (GFCI) protection is essential in these locations to minimize the risk of electrical shock to patients and staff. Concrete floors can readily conduct electricity, increasing the potential for a dangerous current path if a fault occurs. Ground fault protection works by monitoring the current balance between the hot and neutral conductors. If a difference in current is detected, typically 5 mA or greater, the GFCI trips, quickly interrupting the circuits and preventing electrical shock. The National Electrical Code mandates GFCI protection in various healthcare settings where patients are likely to be in contact with grounded surfaces or equipment. This includes areas where wet conditions may be present or where electrical equipment is used near the patient. In a dental clinic, the presence of water, saliva, and other conductive liquids combined with the use of electrical dental equipment creates a heightened risk of electrical shock. The concrete floor further exacerbates this risk by providing a conductive path. Therefore, ground fault protection is a critical safety measure. While other options, such as minimizing the likelihood of spilled liquids entering the receptacle, installing with Schedule 80 rigid non-metallic conduit with an equipment grounding conductor, and installing with a metal raceway and an insulated equipment grounding conductor, can enhance safety, they do not provide the same level of protection against electrical shock as a GFCI. A GFCI directly detects and interrupts ground faults, while the other measures primarily focus on preventing faults from occurring or providing a path for fault current to return to the source. The National Electrical Code section addressing healthcare facilities outlines specific requirements for electrical systems in these environments. This section emphasizes the importance of minimizing electrical hazards to patients, staff, and visitors. Ground fault protection is a key element of this safety strategy. When installing receptacles in concrete slab floors in patient care areas of dental clinics, it is crucial to select GFCI-protected receptacles and to ensure they are properly installed and tested. Regular testing of GFCI receptacles is recommended to verify their functionality. This involves pressing the test button on the receptacle and confirming that the receptacle trips. If the receptacle does not trip, it should be replaced immediately. Furthermore, all electrical work in healthcare facilities must be performed by qualified and licensed electricians who are familiar with the specific requirements of the National Electrical Code and other applicable codes and standards. Proper wiring methods, grounding techniques, and equipment selection are essential to ensure the safety of the electrical system. The installation of ground fault protection is not merely a matter of code compliance, it is a fundamental safety measure that can save lives. By protecting against electrical shock, GFCI receptacles significantly reduce the risk of injury and death in healthcare environments. Therefore, it is imperative that all healthcare facilities prioritize the installation and maintenance of ground fault protection in accordance with the National Electrical Code and other relevant regulations. The specific requirements for ground fault protection in healthcare facilities may vary depending on the location and the type of healthcare service provided. It is essential to consult the latest edition of the National Electrical Code and any applicable local codes or regulations to ensure compliance. In addition to ground fault protection, other safety measures should also be implemented in healthcare facilities to minimize electrical hazards. These may include regular inspections of electrical equipment, proper training for staff on electrical safety procedures, and the use of isolation transformers to reduce the risk of leakage current. By implementing a comprehensive electrical safety program, healthcare facilities can create a safer environment for patients, staff, and visitors. The National Electrical Code provides detailed guidance on the design, installation, and maintenance of electrical systems in healthcare facilities. This code is updated regularly to reflect advances in technology and changes in safety standards. It is important for all electricians and healthcare facility personnel to stay up to date on the latest requirements of the National Electrical Code. Ground fault protection is a critical component of electrical safety in healthcare facilities, and it is essential to understand the requirements for its installation and maintenance. By following the guidelines of the National Electrical Code and other applicable codes and standards, healthcare facilities can minimize the risk of electrical shock and create a safer environment for everyone. The use of GFCI protection is not limited to receptacles in concrete slab floors. It is also required for other receptacles in patient care areas where there is a risk of exposure to wet conditions or where electrical equipment is used near the patient. These may include receptacles near sinks, showers, or other sources of water. The specific requirements for GFCI protection will vary depending on the location and the type of healthcare service provided. It is essential to consult the National Electrical Code and any applicable local codes or regulations to ensure compliance. In addition to GFCI protection, other safety measures should also be implemented to minimize electrical hazards in healthcare facilities. These may include regular inspections of electrical equipment, proper training for staff on electrical safety procedures, and the use of isolation transformers to reduce the risk of leakage current. By implementing a comprehensive electrical safety program, healthcare facilities can create a safer environment for patients, staff, and visitors. Ground fault circuit interrupters are designed to protect people from electrical shock by detecting ground faults. A ground fault occurs when electricity flows through an unintended path to ground, such as through a person's body. GFCIs work by monitoring the current balance between the hot and neutral conductors. If a difference in current is detected, the GFCI trips, quickly interrupting the circuit and preventing electrical shock. GFCIs are required in many locations where there is a risk of exposure to wet conditions or where electrical equipment is used near people. These locations include bathrooms, kitchens, laundry rooms, and outdoor areas. In healthcare facilities, GFCIs are required in patient care areas to protect patients from electrical shock. The installation and maintenance of GFCIs are essential to ensure electrical safety. GFCIs should be tested regularly to verify their functionality. This involves pressing the test button on the receptacle and confirming that the receptacle trips. If the receptacle does not trip, it should be replaced immediately. All electrical work should be performed by qualified and licensed electricians who are familiar with the requirements of the National Electrical Code and other applicable codes and standards. Ground fault protection is a vital safety measure that can prevent electrical shock and save lives. By understanding the requirements for GFCI protection and implementing a comprehensive electrical safety program, we can create a safer environment for everyone. The National Electrical Code (NEC) is a comprehensive set of standards for the safe installation of electrical wiring and equipment. It is updated every 3 years and is widely adopted by states and local jurisdictions in the United States. The NEC contains specific requirements for healthcare facilities, addressing the unique electrical safety challenges in these environments. These requirements cover a wide range of topics, including ground fault protection, isolation power systems, and essential electrical systems. The NEC is an essential resource for electricians, engineers, and healthcare facility personnel involved in the design, installation, and maintenance of electrical systems in healthcare facilities. Compliance with the NEC is crucial for ensuring the safety of patients, staff, and visitors. The NEC provides detailed guidance on the selection, installation, and testing of electrical equipment in healthcare facilities. It also addresses the specific requirements for different types of healthcare facilities, such as hospitals, nursing homes, and dental clinics. The NEC is a complex document, but it is essential for anyone involved in electrical work in healthcare facilities to be familiar with its requirements. By following the guidelines of the NEC, we can create a safer electrical environment in healthcare facilities and protect patients, staff, and visitors from electrical hazards. Ground fault protection is just one aspect of electrical safety in healthcare facilities. Other important considerations include proper grounding, isolation power systems, and essential electrical systems. Proper grounding is essential for preventing electrical shock by providing a low impedance path for fault current to return to the source. Isolation power systems are used in critical care areas to reduce the risk of leakage current and electrical shock. Essential electrical systems provide backup power to critical equipment in the event of a power outage. By addressing all of these aspects of electrical safety, we can create a safer environment in healthcare facilities. The National Fire Protection Association, NFPA, is a leading organization that develops and publishes codes and standards related to fire and electrical safety. The NFPA's National Electrical Code, NEC, is the most widely adopted electrical code in the United States. The NFPA also publishes other codes and standards related to healthcare facilities, such as NFPA 99 Healthcare Facilities Code. These codes and standards provide comprehensive guidance on the design, installation, and maintenance of electrical systems in healthcare facilities. The NFPA is an essential resource for electricians, engineers, and healthcare facility personnel involved in electrical safety. By following the guidelines of the NFPA, we can create a safer environment for patients, staff, and visitors in healthcare facilities. In addition to the NEC and NFPA 99, other codes and standards may also apply to electrical systems in healthcare facilities. These may include state and local building codes, as well as standards from organizations such as the American National Standards Institute (ANSI) and the Institute of Electrical and Electronics Engineers (IEE). It is important to consult all applicable codes and standards to ensure compliance. Electrical safety in healthcare facilities is a complex issue that requires a comprehensive approach. By understanding the requirements of the NEC, NFPA 99, and other applicable codes and standards, and by implementing a comprehensive electrical safety program, we can create a safer environment for patients, staff, and visitors.